In an era of pressing information technology needs, but reduced hospital budgets, Chief Information Officers have the difficult task of driving organizational improvement while keeping a close eye on expenses. Recently, I spoke with Tim Zoph, Chief Information Officer for Northwestern Memorial Healthcare in Chicago, who talked to me about how hospitals can extract value from information technology in difficult economic times.
We're an industry that has historically been behind in IT investments, but any fair read of that now, with about 50% of U.S. hospitals now being eligible for meaningful use and about 11% of physician practices, tells me that we're getting through this early stage of adoption and implementation. I think the thing that's important to know about that is that the value piece of that is not in the initial use. Really, the implementation and adoption, it really comes later on in what I would call an optimization phase. And what that means is that once you actually have the technology in, people get comfortable with it, and importantly, you have data as a byproduct of that, it really allows you to then measure and analyze your organization. So you think about healthcare, we now are getting to the tipping point where we have this data that's coming to us about our organizations. But importantly, there's another factor to this, which is really having built, along with the technology, cultures of safety and improvement. That is a desire to be better, if not the best, in what you do. And then taking that information and then driving that through that improvement and really having, really getting outcomes for it. So I'll just give you one example. We're an organization that has invested early on in technology. We have these cultures of safety and improvement. Last year we did 23 projects, touched 400,000 patients with those improvement projects, and actually had a measurable yield of $25 million in savings.
Tim also discussed how hospitals can target their IT investments to achieve meaningful organizational improvement, ultimately driving better patient care.
It's not a matter of managing cost anymore just at a departmental level. I think we've really gotten good at that. What's really challenging now is to say, how do we manage it? How do we manage improvements across the organization? That is, how do we measure new models of care? The only way you're going to do that is really with automated systems and better data and a capability now to analyze your organization more completely. That really comes once you've made those technology investments, driven it deep, and begin to have the data come back at you in a meaningful way. What's important now is to really take a look at how do you really work across the organization. That is, improve several things. Really, the productivity more broadly. How do we get people, more productive now with technology systems? How do we use these information systems to really help us understand what's the appropriate level of utilization for a patient? One of our studies in our community service areas is to look at diabetes. Actually, there's some and even in Chicago, there's our locations and zip codes with some of the highest levels of diabetes in the country, if not in the world. And so we are using that data to really understand how to better treat those populations. And it's important that if you go in and analyze that you have a good baseline, that your researchers then have access to analytical tools. And then as you begin to imply these improvements or these therapies and care treatments, you can really begin to see how it is that you're actually improving a population.
And finally, Tim took a look at how CIOs can redeploy their staffs to both optimize effectiveness and prepare for an increasingly mobile IT landscape.
I think any CIO would tell you they all have to be poised to be able to do more with less. So we're going to have to be more productive. I think one of the really important aspects of running IT now is to know where your staff spends their time. Know what your supply really is to the organization, and be very transparent about that. So, we time track, we measure our time, and we provide a lot of information to the organization about, are we doing project work? Are we doing optimization work? Are we doing break and fix work? And making sure that that's really well understood. But over time, I think what you're seeing is a shifting of talent and resources in IT as well. So going forward, we had, prior to this, we had, they really have a lot of staff that understood how to implement new systems, how to do the project work, how to get things up and running. Going forward, we're going to need more analytical capabilities for the reasons we talked to you about. Now that we've got the infrastructure in, we're really going to be focusing on how to use that information to optimize the organization. So I'm going to need the analytical capability. The other changing skill set too for us is the world is mobile. Mobility and engaging our patients in their health and having them more of a partner in their care using technology. Those are a very different skill set than the skill set we have to run our core transaction systems. So as I think about the era that we're in now, it's a little bit shifting from implementing the infrastructure to now saying how do we really optimize the technology we have to better run the organization, but also get ready poised for this next era, which is mobility, which is engagement, which is really reaching out to patients, clinicians in the community with technology they use every day.